Good afternoon, everybody. Welcome to the first Health and Human Service Committee meeting of the year. It is February 18th. It's 1 p.m. and we are getting ready to get started. There will be some changes to the agenda, if that's okay. We do have some lengthy discussions, I imagine, and there's 9 resolutions, and I want to make sure that we get through those so department heads are not waiting till March. So we can start with public comment, the minutes approval, appointments, and then kind of go into some of the resolutions and then go from there. Is that cool with everybody? Do we have any public comment? We have no public comment. Can I get a mover to approve the minutes from December? Rachel moves, Veronica seconds. All those, we got to do a roll call?
Right.
We have to do a roll call. Do I call them out?
You can or I can, up to you.
All right. Christy.
Here.
We're voting on the minutes. Approval from December.
Yeah, can you hear me? It's good. Okay. I'm good, yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that's unanimous. Appointments. We have several appointments for advisory board appointments. Youth Services Board. Becky Koenig, Town of Groton representative, term expires December 31st, 2028. Susie Gutenberg Fitzpatrick, Town of Ithaca representative, term expires December 31st, 2028. Margaret Kirch-Gessner, Town of Danby representative, term expires December 31st, 2028. Christine Montag, Lansing representative, term expires December 31st, 2028. Community Mental Health Service Board, Jessica Connor, psychologist, term expires December 31st, 2029. Community Mental Health Service Board, Mental Health Subcommittee, Jessica Connor, Community Mental Health Service Board representative, term expires December 31st, 2021. Do we have a mover? Second? Any questions? We'll go to a vote. Christy?
Yes.
Mike Sigler?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes. That's unanimous. 2026 legislator appointments. Board of Health, Christy Bianconi, legislature term expires December 31st, 2031. Rec Partnership Board, Rachel Ostlund, I just had a legislator term expires December 31st, 2026, and we do have one more slot for legislators. Is there anybody interested in participating on the Rec Partnership Board? All right, we'll figure that one out.
When does it meet?
Fourth Tuesday, but not every month at 5:30.
Every other month.
Yeah, so they meet the fourth Tuesday from 5:30 to 6:30. It's online, and they meet, let's see, February, March, April, and then they meet again in June to vote on the recommended budget that they're going to put forward. But that's it. If we need later meetings in the fall, we can, but we haven't needed those for the last few years, so just 4 meetings.
I can't commit right now.
Okay. All right, so we will circle back to fill that one. Do we have a mover?
Well, no, Travis, I'll do it because it's not going to conflict with the ledge meetings because it's the fourth. Well,
Okay.
I'm trying to think if it would conflict with our legislative meetings.
No? We're first and third.
We're first and third. Okay, then I'll do it.
All right. So we have Christy Bianconi also for the Rec Partnership Board. Legislative term expires December 31st, 2026. Do we have a mover? Rachel moves. Veronica seconds. Christy? We're voting on
Yes.
that. Yep. Right?
Yes.
Mr. Sigler?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes. That is unanimous. Last one for appointments. We have 2026 Health and Human Service Committee Liaisons, Human Rights Commission, Travis Brooks, 2026 Legislator Liaison Assignment, Tompkins County Youth Services Board, Veronica Pilar, 2026 Legislator Liaison Assignment. Do we have a mover?
Oh, this one's just an announcement.
Huh?
Just an announcement on this one.
Oh, this is just an announcement, so we don't need to move it. All right, we are done with the appointments. So let's move to Office of the Aging, since Lisa's here. And we have two resolutions, and then Lisa could share any updates that she would like to share. Resolution 1, Budget Adjustment, Office for the Aging, 2026, Expanded In-Home Services for the Elderly Program, EISEP. Budget Increase ID 13859. Do we have a mover? Veronica moves. Do we have a second? Rachel seconds. All right, Lisa.
Hi, excuse me, thank you. So this resolution is just a part of a resolution that we put through in November of 2025. We had a final allocation of our funding that came around November, and we used part of it in 2025. This is the remainder of that increase in our funding. So 26,537 will go into 2026 to be used. That's pretty much it, unless you have any questions.
Any questions for Lisa? Rachel?
So this is just moving money into the new year.
Yes, so we can allocate it to our contracts, yes. Mhm.
Any other questions for Lisa? We're ready to vote. Christy?
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that passes unanimously. Second one for Office of the Aging, for the Aging. Budget Adjustment, Office for the Aging, 2026, Unmet Needs Budget Increase, ID 13860. Do I have a mover? Veronica moves. Second, Rachel. All right, Lisa.
This is along the same lines. It's just another funding source that we receive from the state, our unmet needs funding. We did put a resolution through in November for part of it to be used in 2025. This is the remaining amount of that funding to be used in 2026. Most of it goes toward our contracts, transportation, legal services, home repair, and in-home care services. So that's just the remainder of it.
Any questions? Do you still have a wait list for?
We do. Our home care wait list has gone down a little bit. We have about 4 or 5 people on it right now, but it's kind of a balance because you don't really want to advertise a program that you're immediately putting somebody on a wait list for. So it's
Right.
kind of hard to do, but as funding comes in, we kind of open up information and say we have availability. Right now, we're down 1 home health aide, and there's not a lot in the community with our agencies, so it's another reason why people would go on a wait list. So we're hovering around 4, which is improved. Our home repair wait list, that's pretty high. The minor home repair program was up in the 40s to 50 people waiting for home repairs. And then about 10 people on our legal services waiting list. So there's always a waiting list. It just depends how much information you get out to people. There's always need, but the waiting list fluctuates.
What's the minimum age for the home repair service?
So we contract through INHS, and we have county funding and state funding that go into that program. So they call it the minor home repair program, but they have other funding sources for that as well, like the Restore program, Access to Home program. So it depends. We just pretty much refer people over there. They figure out where they fit into the puzzle,
Gotcha.
depending on eligibility and things like that. So between our program, we have about 40 people waiting for what we offer.
Thank you. Any other questions for Lisa? Rachel?
So the minor home repair program at INHS, this is the same program because you're just.
Yes,
Do they have a bigger program?
bunch of different funding sources, how they fund that program. This is just one way that they fund it. And again, the eligibility varies depending on what program is funding it. So,
Okay.
yeah.
Okay, I was going to ask if you ever send people to that program if they're on a wait list for years, but it sounds like.
It's the same
all the
program.
same
Yeah. Same program. Yep.
Yeah. I was going to ask the same thing, so thank you. I just want to say I've always loved the name of the Unmet Needs Program. It's a good concept. And also, thanks for the update on the home care. I think the home care system is just a crisis,
It is. It has been.
top to bottom, systemically.
it's tough. Yeah, it's a struggle. We keep working on it, but it is definitely a struggle.
All right, are we ready to vote? Christy?
Yes.
Mr. Sigler?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that is unanimous. Lisa, while you have the microphone, you want to share, give any updates?
Don't really have any updates. It's pretty much business as usual. It's one of our slower times as far as programs go, but we're just kind of preparing for our big move. So just slowly getting things together, making sure that happens, kind of packing, but we're getting there. So yeah, that's all I have.
Please let us know what we can do to help with that move.
Yeah.
I know it's a big undertaking. There's a lot of different balls and everything going on. So if there's anything we could do to help or support you, please let us know.
Yes, the timeline is always fluctuating a little bit, but we're getting closer and closer to the point where we'll get there. Thank you. We appreciate that.
We have Kate Shanks Booth here. We'll hop over to Youth Services Department. There's 2 resolutions. How you doing today, Kate?
I'm doing okay. How are you?
I'm good. We'll hop right into it. Budget adjustment, Department of Social Services and Youth Services, ID 13810. Do we have a mover? Rachel moves, Veronica seconds.
So basically, this is just a budget adjustment. These are the safe harbor, or the CSEC, which stands for the Commercial Sexual Exploitation of Children funds that come in annually. We don't know what the number for the coming year is going to be until late in the year. So our budget process is prior to that. So this is just to accept that $16,949 and then apply it to this year's contract is all this is.
Any questions for Kate? Seems pretty straightforward. All right, we'll go to a vote. Christy?
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that is unanimous. Budget adjustment, Youth Services Department, final 2026 state aid figures, ID 13826. Do we have a mover? Rachel moves, Veronica seconds.
So this is basically along the same lines. The numbers for the state aid don't come in until later in the year after the budget process is done. So these are funds set from the state to do youth development, runaway and homeless youth, also youth sports education funding, which is the gambling money that comes in from that sense, and then the team sports funding as well. So we allocate and then contracts based on that amount. So this just allows us to receive it and adjust those as needed.
All right, any questions for Kate? No? All right, we'll move to the vote. Christy?
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that is unanimous. Youth Services Board, that's you as well, right? All right, Youth Services Board, resolution in support of amended Tompkins County Youth Services Board bylaws to adjust membership and residency requirements. 13863. Do I have a mover? Rachel moves, Veronica seconds.
Yeah. So basically what this is we have, our board is made up of appointed seats from municipalities and at-large seats. We had 7 at-large going into this process. We wanted to bring on a probation officer that works here in Tompkins County, but unfortunately that person lived in Cortland County, which is the issue with many of the staff that work here. And so basically what this does is it takes one of our at-large seats and makes it a Tompkins County employee position regardless of residency. So we'd be able to add someone from probation or from DSS or from mental health, for example, whole health, if that was needed. So that's basically all that this is.
All right, any questions for Kate? All right, we'll move to a vote. Christy?
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that is unanimous. Kate, would you like to share about the youth services?
Yeah, so I think the last time I was here, I was saying that we were doing the youth service specialist interview rounds. We did that. We had 3 good candidates, and unfortunately, those candidates either stepped back or received or took another job while we were in our process. So we are posting that position again, and hopefully we've got about 4 candidates now that have come in. So I'm hopeful that we'll have that soon. And I'm happy to announce that the framework, Achieving Youth Results, that's how we're represented in the plan. We're going to be updating those to wellness domains. And so we last week had a conversation with Adrienne Bard from KBD Consulting, who's helping the state OCFS change their process. Hopefully we're going to be bringing her here and rolling that out. So we'll be presenting that to you soon.
Awesome. Any questions for Kate? Thank you, Kate. We will slide over to the whole health department. We have 4 with the department. Excuse me. We will start with the first resolution to reclass an administrative assistant position to a health information specialist position, whole health department, 13842. Do we have a mover? Rachel moves, Veronica seconds. Jenny, would you like to
Yeah,
share?
thanks. Hi, everybody. This is just purely a title change to kind of better reflect the role and the work that we're hiring a person to do. I think everyone can appreciate that when you're applying for a job in government, it's very hard sometimes to look at the job description and know what the job actually is. And so this just moves us closer towards a clearer understanding of what the role and the work is, which is records keeping, things of that nature.
Got you. Any questions for Jenny? Rachel?
So is this a person that's already been in this position, but they're kind of doing work outside of the?
This is a person who is retiring, and now we have the opportunity to reclass the role. And so we were reclassing it to kind of better fit the scope of work that was being done.
Okay, and paying more to compensate people for the.
It's, the pay grade is the same. It's really just moving sort of from saying like, you're an administrative assistant and can do a million things to like, you're a health information specialist. And so your focus is a little bit more narrow, but it's in the same pay grade. Yep.
Any other questions for Jenny? All right, let's vote. Christy?
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that's unanimous. All right, authorization to accept New York State Association of County Health Officials, NYSACHO, Climate Change and Health Adaptation Project Funding and Budget Adjustment, ID 13848. Do we have a mover? Rachel moves, Veronica seconds. Go ahead.
So we are very excited about this. It is a very small grant of just $3,000, but we are going to be using it for an education campaign this summer around HABs. Thinking particularly how to reach people who live and live on the lakefront, also visitors who might go to the lakefront, doing some more targeted outreach, and really working with a couple of our partners more closely on sort of a broad marketing campaign for this summer. So we were thrilled to have gotten this funds and are really looking forward to rolling this out.
Awesome. Any questions for Jenny? Rachel?
So this is just about warning people of the dangers of HABs if they're about to use the lake. It's not about trying to get information to people who might be somehow contributing.
No, it's specifically sort of education and awareness for people who recreate and go to the lake.
Okay.
Yep.
Any other questions for Jenny? No? Let's vote. Christy?
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that is unanimous. Authorization to accept funds, create position, and complete a budget adjustment, care licensed clinical therapist, whole health department, ID 13854. Do I have a mover? Rachel moves, Veronica seconds. All right, Jenny.
So this one is also a really exciting one. We had the opportunity to create, currently as you all may or may not be familiar, we have care team clinicians, which are co-located with law enforcement. We have 2 clinicians co-located with the sheriff's office, and at the moment we have 1 at IPD. In the past, the Whole Health had contributed some funding to an outreach worker program downtown. This responsibility has shifted fully to the city, which we feel good about, the city feels good about, no problems there. And so that has allowed us to pivot some of this funding to go towards supporting another care team member, and then the city is also contributing part of this fund since this person will be co-located with IPD. So this resolution is sort of shifting the funding, creating the position, yada, yada, yada. All of the technical things that are required to realize the second care team member.
All right. Any questions for Jenny?
I have a question.
Yeah.
Hey, Jenny.
Hi.
Hi. So the care team clinicians, did they only respond to crisis, or did they also have clinical individual caseloads in addition to that?
They only respond to, they don't carry a caseload in a traditional way. I wouldn't say that they only respond to crisis. They often respond to crisis and then help that individual move through whatever system it might be, whether it is moving them into housing, whether it's supporting some sort of a partnership with DSS. You know, our care team clinicians are at Code Blue very frequently working with individuals there. So they're not necessarily maintaining like a patient panel, if you will, but they are supporting individuals that they regularly interact with, you know, beyond just kind of like a quick de-escalation moment in time or call through 911.
Okay, so the position is really just focused on that crisis outreach work.
Yep.
And what are the supports that the county has in place if they're exposed to, say, a traumatic event?
Yeah, I mean, we work on this and think about it. We are building out the forensics team and bringing on a new forensics supervisor at the moment. And so we have both touched base with our team when something like that happens, doing a debrief, understanding if they need other supports, and have been having some discussions around partnerships with other local mental health departments if people want support, but they don't want to necessarily come in their own backyard to receive those. So being able to send them over to, you know, a different county or something of that nature.
Okay. Okay, good. So the care team clinicians that are there already embedded, have they maintained those positions over time, or that they seem to be stable in those roles?
Yeah, they're very stable. I mean, I think they really enjoy the work. They are staff who are interested in that kind of role and placement. And have really sort of developed amazing partnerships with the sheriff's office, with IPD in a way that like allows them to sort of extend their reach and expertise a little bit, and a learning opportunity for the officers that they're also working with. But yeah, we haven't had any turnover in our care team staff.
Okay, I just have one last question. So the care teams, have they fully replaced the mobile crisis team, or is that still functioning in a separate capacity?
The mobile crisis team is functioning. I wouldn't say it's in a separate capacity. I would say it's all part of an integrated team. And the care team and the folks who are on call for mobile crisis meet to do any sort of handoffs that might be needed for people who are on call for mobile crisis. So they really work hand in hand, but they're both still things that happen.
Oh, I see. So the care team roles are, you know, working like business hours, and then they're handing off to the mobile crisis team after hours.
That's right.
Okay.
Yep.
Thanks.
I've had the pleasure of working with the care team with Christy for the last year and a half now, maybe, through LEAD. And it's definitely been a valued addition to our monthly meetings. We meet twice a month. But the insight and the relationships with IPD and other organizations, you can see the value, especially when we start talking about different folks that, you know, need the services. So I'm glad to see another one coming on. I think it's a really good program. Ready to vote? Oh, Rachel?
So this will just mean that there'll be 2 clinicians that are co-located at IPD and then 2 co-located at the Sheriff's Department?
Yep, that's right.
So then if let's say both clinicians at the Sheriff's Department were out sick or something, can they kind of transfer between the 2 and kind of cover each other?
They not in that regard, like you wouldn't have one that sort of subs in, but they do remain in very close contact, and we don't adhere to these sometimes rigid boundaries that might happen in terms of city and county. So I think we really see the whole county as our responsibility. So it isn't that just because someone is necessarily co-located with IPD, that if there is a situation that involves them in Cuba Heights, that they wouldn't necessarily go and respond and support. So I think we do try to kind of keep folks within the teams that they're in, but in those moments where you do have to flex out into a different space, like absolutely no problem with it. We're the county department.
Okay, great.
Yeah.
Veronica?
Yeah, Jenny, in your response to Christy, you were describing like other things other than immediate response that the care team clinician might do. So to clarify, is the care team clinician, when on the job, always accompanied by a law enforcement officer, or are they also doing some of this check-in stuff
You know, that's a great question. I would say that they are not always accompanied by a law enforcement officer. I think particularly for sort of support and help at Code Blue, I think that our officer who really works closely there, like she might be there on their own. We actually now, Christy, you mentioned this. We are starting to, one of our care team clinicians is going to be leading a group with folks who are at another one of the THA shelter sites. So like they wouldn't necessarily be partnered with an officer for that. So it's really more the immediate response calls. I don't, it's not all the time. I said I don't think, but I know it's not all the time.
Thank you.
All right, any other questions? Let's move to vote. Christie?
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that is unanimous. One more for whole health. Resolution urging the New York State Governor and State Legislature to restore funding for Healthy Neighborhood Program ID 13874. Do we have a mover? Rachel moves, Veronica seconds.
So this one is a little less exciting. We have a program at Whole Health called Healthy Neighborhoods Program. It is a home visiting program that goes into people's houses looking for things like lead, supporting with baby proofing, supporting with use and understanding and awareness on how to use smoke detectors. What's the word that I'm looking for? The red things that put out fire extinguishers. Wasn't coming to me.
I was getting excited. I was going to say graffiti. Spray paint.
Asthma education, things of that nature. It's a really wonderful program. It's been a part of Whole Health for a really long time. Diana Crouch leads this program. She joined us on the call. Really, unfortunately, this is a fully state-funded program, and at the moment, this is slated to be cut in the governor's budget. So this is an ask for you all to sort of share a countywide resolution just supporting Healthy Neighborhoods Program that we will then share with NYSHO, which is the New York State Association of Health County Organizations, to kind of also share with the New York State Assembly and other powers that be that sort of we really do support this and we hope to see this continue. We're doing some other education around this. I am touching base with Representative Kellis to chat about it. We'll be sharing too with Senator Leah Webb. So we really hope that this stays in the budget, and we would really love the support of this body too, to kind of really, speak out and say what a value we think this is to the community.
All right. Is there any questions for Jenny? Veronica?
You said in the resolution the amount that's being cut from the program, 1.45 million. Do you know is that the entire program, or do you know what the total budget?
I would say that's the entire program for New York State. Within us, I don't have right in front of me the line item budget. I pulled up all the stats on the impact, but I don't have the amount that our program is budgeted for. Diana might be able to answer that off the top of her head, but if not, we can get that. We could get that back to you. But it's a full, for us, it's a 1.5 FTE and fringe.
Okay.
And supplies.
My question was more if at the state level, are they
at the state level.
Cutting the program to zero?
Yes, to zero.
That's terrible. Second question, I guess just since Diana's here, I want to invite, do you have anything more to add or share about the program?
So Tompkins gets $199,000 a year. And that covers all of Tompkins County. It saves lives. And we have people that have contacted us after a visit to say that the fire extinguisher we gave them saved their life. The carbon monoxide alarm we gave them woke them up and saved their life. So I feel very strongly and passionate about the program.
Diana said to me when we were meeting about this that the thing she's most upset about is the time that doing all of this rigmarole takes away from her time with clients and meeting community members. So I think that speaks volume about her dedication and sort of the touch that she's brought. She came and did a Healthy Neighborhoods visit to my house so that I could see what the program was like. It was awesome. So I think we're really hopeful that the state will sort of backtrack on this.
Rachel?
If they don't end up funding this program, is there a way for us to look at like how to fund something similar locally?
Yes, you will be hearing from me.
Any other questions, Veronica?
Maybe just a maybe quibble question about the wording in the resolution, or question about down in the resolved. The first resolved is saying that on recommendation of this committee, the Tompkins County Legislature requests NISAC to call upon the governor and legislature to restore funding. The second resolved says that NISAC affirms restoring healthy neighborhoods funding as essential to protecting vulnerable populations, et cetera. But is this resolution supposed to be inside the scope of the county legislature? In which case, I don't know that that is something that we can resolve.
Oh, yeah. So, okay, this was an in under the wire draft resolution. So I guess that's a great question. Taylor, I could use your help here. Yep. We had intended to sort of tailor it to Tompkins County, but we got it in on Tuesday of 4:30.
No, this is not a criticism.
No, it's okay.
Well, while it's here.
So yeah, I guess I don't know. Can you approve it with amendments? Or what's the process?
Oh, what is it? Oh, she's right there.
Katrina is pulling it and taking a look.
Okay.
So can we table this and allow Jenny to report out on whole health? So let's table this while Katrina does her research, and then we'll hop to your report out.
That sounds great. I'm not sure. I also lost the thread on whether or not there were materials submitted for departmental updates. Anyway, all right. So
I don't have any.
You don't have any. Okay. So I'll do an overview and then we can talk about this in more detail next month. I understand we had a tight agenda today. I wanted to share a little bit about a realignment effort that I have been taking on the public health side of whole health. When I started in this role, I think the public health team has really sort of just been in autopilot and survival mode in some ways since COVID. There also was, the merger with mental health, which took a lot of time and attention, kind of focusing on the big picture merger and not necessarily so much reflection or time spent looking at how the public health services were sort of organized and structured. This is not a negative reflection on how things had been structured. I think everyone agrees we're living in a different world in 2025 than we were in 2019. And there just hadn't really been a hard look at how programs had been grouped or things of that nature. So we have taken the time to do that over the last several months and are going to be shifting some programs around. I'll share some more materials on what that looks like for our next meeting, but the broad gist of it is that we're looking to create one sort of healthy families or division of children and families type division that includes all of our programs that work with families and young people, babies, infants, kiddos 5 and under, and then also bringing together a lot of our more community wellness, prevention, chronic disease work into one team. So we'll have those sort of as two North Stars guiding the work of the public health services rather than the way it's currently structured where there's three different programs that could work with moms or dads and new babies or pregnant people and new babies in 3 separate divisions. So we're just kind of looking to move some programs around so that it's a little bit more streamlined and we can sort of better look at the community needs. And I can have more on that, including more granular details on what's moving and things like that.
So this will allow you to continue to kind of treat the whole person as they come in, right?
Yes.
Like this has kind of been where whole health has been headed. You've all done some amazing work already to get there. So to me, this sounds like more of that, like continuing to do that in other areas of the department.
Yeah, I think that's right. I mean, I think this also allows us to figure out how to better bring mental health with public health. Right now, it's, for example, we have a mental health counselor who recently received her perinatal mental health certificate. I don't know if certificate's the right term. And at the moment, she would be receiving referrals in our current structure from 3 different programs at mental health. And after we sort of do this alignment, she'll be receiving referrals from 1 program in mental health.
Gotcha.
So it really allows for them to develop better collaboration across mental health and public health. Once public health is a little bit more structured in a way that allows for a clearer understanding of what each of the divisions do.
That's awesome. Rachel.
So for example, if someone went to OBGYN Associates and, the nurse there connected them, would they be connected to, would there be like one entry point in the Healthy Families division?
Yep.
They would then kind of get branched out so they wouldn't have to meet with multiple.
Yeah. So the Healthy Programs Division at the moment, this is sort of still proposed, but we're pretty close there. It's going to include WIC, women, infant, and children. It's going to include our early intervention and preschool age programs, which is also kiddos birth to 5. And it's going to include all of our maternal and infant health programs, our Moms Plus program. We have a community health worker grant, which is for also serving pregnant people and newborns and infants. And it'll, like our Safe Care program, which works with DSS and families, and our lead monitoring program. So those will all sort of be grouped together, whereas now those are all in separate spaces.
Okay, so this program would also kind of connect them with services at DSS that they might need, so it'd also be like a
Yeah,
handoff.
I mean, that's the idea. I mean, I think I'm at the moment, I'm just committing to bite off that our internal collaboration and referrals, but I think we will be better positioned to interface with community partners and our sibling agencies from there. And again, it's not a reflection on the fact that the old structure might not have worked for that moment in time, but we're trying to be responsive, good fiscal stewards, and build in a way that allows us to be flexible and meet community needs into the future.
Awesome. Let's circle back to the.
Wait, can I ask?
Absolutely.
Yeah. I would find it helpful if you could at some point share materials on like, what are all the programs in whole health and how are they organized now and how are they going to be organized? Maybe you could do this right now, but please don't, because I won't be able to take it in verbally.
No, that's fine. I can. I think there's more time in our meeting agenda to talk about these for more departmental updates in March.
Yeah.
So I have that. I think we weren't sure how much time we'd have today. So
that makes sense. Awesome.
We're thinking we'd have a really packed agenda with all the different resolutions, the conversation about Office of Human Rights and a few other things. We didn't want to rush people or have people come back in March or April. So I think in March, we'll do half the group. April, we'll do the other half. And then, that will be the centerpiece of the agendas. All right, back to the resolution.
Yes.
What did we discover?
So the response for the resolve statement to Veronica's question that starts on line 39 and ends on 41 is that that is appropriate so long as the department can confirm that that's correct information. Like you have received confirmation.
Oh, okay.
That NISAC affirms that.
Take a look at it. Yeah, I mean, that's fine. There's a lot of folks who are out there doing education around the importance of this, and I know NISAC is doing that and is calling upon them, so I think that's it's fine.
Perfect. So as long as there's no amendment, we can vote on the resolution as it stands.
All right, was there other questions? No? Are we ready to vote? Christy?
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I am a yes. That is unanimous. Jenny, was there anything else you wanted to share from Whole Health?
That's it. Sorry for this teaser and not giving you everything, but I'll be back.
It's a good teaser, though. I like this.
Completely fine. Thank you.
All right, we're going to, go ahead, Lisa.
I just have a question. I'm sorry, I should have probably brought it up when I was talking earlier.
It's all good.
I noticed you were talking about the advisory board liaisons. We have an advisory board too, and I didn't hear anything mentioned about ours. I just was curious.
We will get back to you on
Okay, thank you.
We got you. For the chair's report, there's several items. There is the 2026 Health and Human Service Committee liaisons. We did that. We have the goals and work plans for 2026. So I'll read the goals real quick. I sent them out to everybody. These were collected from the different legislators, and we put together the ones that appeared the most. There's several of them. It's ambitious, and we're going to actually get started on some of them today. The Crisis Stabilization Center, this appeared several times. To try to figure out how to continue this work with Cougar Med or another partner, but really keep the eye on hopefully ensuring that this happens over time. We're kind of, waiting to see what happens with a few opportunities. We can invite Frank Rupa back in to see where they are and get an update from them. But I know that a lot of folks were really concerned that this wasn't happening, this may not happen, and what the status of it is. Is there any legislators that want to share about this goal?
I just want to say that this is, I believe, a high priority because we're lacking. Oh, sorry, Mike. Did I jump ahead of you?
No, you didn't.
Okay. Because we are lacking a local detox, and I think we're lacking a regional detox. And what happens is these folks wind up going to our local hospital, and they do their best, but it isn't there certainly isn't their primary focus. And what happens is folks just keep cycling through over and over. It's really costly, and then folks don't really get connected to the care and to the continuity of care that would really stabilize. And so I know that it almost happened. We were close a few times, but the opiate epidemic is still here, even though it's not getting the same coverage that it used to, and it's still devastating. So I just want to say I think this is high priority for the community.
Mike?
No, I agree with everything you said. I mean, it was when I met with Travis, it was, I think, my number one priority. That, and of course, the mental health stabilization unit. The fact that we could take somebody who, obviously has some issues, and we take them there first to stabilize them is just something we've been missing in the community. I will say I did meet with Rob Lawless from Cuga Medical. He expressed that they are still very committed to this. They are our community hospital, so they do a lot of the jobs that other folks won't do, for the simple fact that, mental health does not make any money. I know that's, maybe a terrible thing to say, but they make money on other things, and that allows them to do mental health. And that is a commitment that I think Cuga Medical has made. I certainly would like to get Frank Krupa, and I know Rob Lawless would be interested in coming in too and talking with us, because from my meeting with him, he was committed to it, but did explain, the financial challenges of it as well. So thank you, Travis.
Veronica?
I just want to explicitly say, the written goal mentions a crisis stabilization center, which I think way back in the community recovery fund conversations was about stabilizing people in acute mental health crisis. And then Christy mentioned a detox center from substance addiction, which is also a very needed thing. And both are needed things, both we don't have. They could be together in one project, like what we were hoping for. I guess maybe not, but I think it's important to state those two things each explicitly, because sometimes we either conflate them or don't specify, but both are important. And I'm guessing that both things, like mental health crisis stabilization and detox, are part of this goal.
Rachel?
Was there an update on because wasn't there an issue with who owned the building or who?
There was issues with the I forgot what you call it. Mike, help me out. The issues with the building were liabilities that. Go ahead.
DC.
Yeah.
Oh no. The ADC had some liabilities with the state, and Cuga Medical was concerned about taking over those liabilities. So that's what they're kind of working on with the state. The other problem is, they wanted to combine the detox and the mental health in one building. The state, those two are very separate at the state. They're run by two different agencies. So then you run into billing issues, and they actually needed permission from the state to actually kind of put them under the same roof. So, yeah, there were a lot of state issues involved, but I think Cuga Med's working through them. I think it's just taking longer than anyone had hoped.
Yeah, the big issue was the lien that was on from ADC and taking that over. We have a few from DSS. We have the federal work requirements and the immediate impact assessment. This is related to the One Big Beautiful Bill, significantly expanded work requirements for SNAP, Medicaid, and child care. I believe there's already a working group in place for SNAP. New York's Able Bodies Without Dependent waiver expires in March, just a few weeks away. We were interested in finding out what that impact would look like. There's several questions. How many Tompkins County residents have lost benefits since November? Projected impacts when the waiver expires, actual staffing needs to manage ongoing compliance, which populations are most affected. I think the easiest way to do this is to send those questions to Brittany and Dina and allow them to have some time on March's agenda to answer them and not put them on the spot to do all this research and answer all these questions right now. Is that okay with everybody? All right, cool. Does that work for you, Dina?
Yes, definitely. We have a work group that's been meeting regularly. Human Service Coalition is heading the group. It's been very productive. We've made a lot of progress. But yeah, having the questions in writing and being able to give you guys a more comprehensive report would be good.
Okay, great. I'll send those along to you all so we can have that conversation in April. Mike, did you have your hand up still?
No.
Resolving the Office of Human Rights structure. That's going to come up in the county administrator's report, so we'll skip that for a second. Office for the Aging Accessibility, we know that there's this move to Dutch Hill, and we just want to ensure that all the support is given to COFA. That's a huge priority to make sure needs are met during that process, and then once you move, how we can facilitate any sort of help and need that arises along the way, so you'll have a smooth transition, and so that our seniors are as least affected as possible from the move. So that is a priority for us because we know this is a big undertaking and a big deal for 2026. Does anybody want to add to that? Okay.
I guess not adding, but highlighting in the written thing we have. I lost it. It suggests reviewing data on various things, service utilization, transportation barriers, whether virtual appointments help, and if the data shows problems, we need to develop solutions. So thanks to whoever wrote that. I think it seems like collecting such data or preparing to.
I didn't hear the first part, Veronica, I'm sorry.
Oh yeah, I'll just read it.
Okay.
Sorry. We should review data on service utilization, transportation barriers, and whether virtual appointments and other accommodations are adequately addressing access issues. Nice alliteration. If the data shows problems, we need to develop solutions. So it seems like maybe collecting that data or identifying like what is going to be tracked, and I don't know what all y'all are already doing.
Yeah, we collect all that now.
Yeah.
So that probably isn't going to be much different, but we will continue to do that to see if there's any barriers that we're missing, and we offer all those things. I mean, it's kind of what we did during COVID too, so we're able to offer virtual, we find people rides, we go to people, so we'll just keep collecting that.
So my suggested step one, you're already on it.
Okay,
Great.
good. We'll share if we run into things.
Christy, did you want to add?
No, I'm good, thanks. I didn't.
I'll skip the next one for a second and come back to that. Mental health services capacity, building on the positive work with care team expansion and peer support services. We want to continue identifying and addressing gaps in mental health access. So we want to work with you all and help figure out how we can continue to aid you in the work that you all are doing and figure out how to meet the needs that you have. I've said this before, it kind of was mind-blowing when Randy and I came to visit in your reopening, just to hear the statistics and realize how much is actually happening there. I think that one of the hardest things to do is publicize the good work that departments do, because you are running from issue to issue and you kind of address a need and you're working on the next thing. And figuring out a way to let the community know these things are happening, these things are available. Like I was blown away in a great way to find out how many counselors were up there, the work that you all were doing in school. So I think one of the goals would be to figure out how to share that better, how to share that more with the community so they know. I know I sent a few folks up there to make contact for counseling services. They were like, oh, they do that up there? I'm like, yeah, I didn't know either. And they were like, all right, I'm on it. And what was interesting is they shared with me what they were paying utilizing another service, and it actually was costing them $175 a visit. And the folks suggested that they come every week, and they were using their employee benefit card, the prepaid dollars for that. And toward the end of the year, by the beginning of November, they had maxed out, and they didn't have money for their medications and all of that stuff. So, you know, I think that's one of the things that we can help with. I think there's some tremendous things happening up there. So we just want to figure out how we could help with that capacity. Shelter services, there's conversations about housing has moved to HHS from HED for folks. And we're still not necessarily clear on what type of housing, but we know at least it is folks that are in temporary housing. It's folks that are in shelter housing, transitional housing. Greg and I feel that long-term housing should stay with HED. It shouldn't be separated out. But all the housing that isn't long-term, I think, would fall under HHS. And so shelter services is a big one, figuring out how to continue to support our shelter, looking at the long-term shelter. So that is a goal for this year. Countywide EMS, I know that's going to fall under public safety. Oh, Christy, sorry, I didn't see your hand.
No, that's okay, thanks. I'm going to just backtrack a little bit about the expansion on the mental health services. You know, I think that there's a few things. People may not be aware of what we're providing at the community level, but unfortunately, even with the great services we provide, there just isn't enough capacity. The demand is always outweighing the capacity. And I think that's the challenge. I'm sure Jenny is really aware of that. And the clinicians are doing a fantastic job of doing the very best they can. But I think what I would really like to do is look at ways that we could increase capacity. People don't always need weekly visits, that is true. But there are, when they're first starting treatment, they do need weekly visits. And I think that the chronic shortage has a huge impact on the well-being of the clinicians because they are taking on tremendous amounts of stress trying to meet the needs of the community, and it just always feels like it's not enough. I mean, to Mike's point, these billable services do not generate a lot of revenue. They're the lowest reimbursed specialty in all of healthcare. That's the chronic issue that we're facing. And so, I mean, we have an awareness of all of this, but I think that we can be innovative and look at some different options to see if we can increase, maybe partnerships with telehealth or with other regional partners and increase our overall capacity because I really think that's where the stretch is happening more than anywhere else.
Thank you, Kristen. Anybody want to respond to that before we move on? We have countywide EMS. It's going to be a big undertaking from public safety, but I believe that there's opportunities for Health and Human Service and public safety to work together on this. I think they kind of cross paths. There will be a working group for countywide EMS. We hope to get that started next week. So if there's folks from HHS that are interested in being on that working group, please let me know. Anything about the EMS from anybody? As you'll see when we get to the Human Service Coalition funding grant process that's on the agenda, I think that one of the goals that I have, one of the goals that Christy and I talked about, I've talked to a few other legislators, is to establish a few working groups throughout the year. I think that we end up with lofty goals, and then we kind of are dealing with needs that come up, and we get into September, and it's all about the budget, and then the year is over. And so if we can find different legislators that are interested in some of these goals and we can move things along while we're working on other goals at the same time, I think we might be able to make better progress than we have in the past by doing multiple things at one time, not having the whole group trying to figure it out, not having admin trying to go from emergency to emergency, but kind of plan this out a little bit and spread the work out so that we're also not saying to departments, here's an issue, figure it out and let us know what you're going to do, but here's an issue, how can we help, and then kind of going through that process. So I think you will see a lot of that as we move along this year. There was a goal for systems coordination and reducing fragmentation. We do continue to hear about individuals and families trying to navigate multiple disconnected systems through DSS, whole health, nonprofits, schools, probations, et cetera. We feel like it would be a good goal this year to explore ways to improve coordination, whether regular provider roundtables, better technology integration, or other mechanisms. And this is a long-term effort, but hopefully we can get started on that this year. The idea, is to continue to do what I think DSS has started to do more of, what whole health is doing more of, certainly COFA and other departments that are working with folks, working creatively to catch individuals and families before they lose permanent housing and need shelter. We would do this by providing, well, there's a lot of different things that we could do. I don't want to go through all of that. Working on issues of youth respite and youth detention beds, improving the experience that people have when interacting with DSS. It is like, I don't know what you do with an agency where you're going in your most difficult times and you need help and you need assistance, and you get denied, right? There's always going to be some sort of friction. So no matter what, I don't know DSS will ever be people's favorite place to go. But how do we improve that experience for folks? How do we share the other things that DSS is doing? I think DSS gets a bad rap, and there's ways to improve that. And so I think that a few members of this committee said that is a priority for them. So we're putting that on as our list of goals. Before I segue, Kate?
Yeah, Travis, to that end, I just wanted, one of the things that I should have announced, so Office of Family and Children's Services announced an initiative this year called the Empire State Results Leadership Network, and we've been selected to be a part of that. So we have youth services, DSS, mental health, and probation. They're going to be working on a project to help with those internal referrals.
Oh, that's awesome.
And to be seeing youth and families in a more holistic way. So I think that's something that's really exciting for us and speaks directly to what you were talking about. So I just want to highlight that for you.
That is awesome. We should talk a little further and see if there's some folks that want to. Cool. On the agenda next, one of our goals, and we're going to create a working group starting today to work on this. Was able to meet with Norma, Samantha, Cindy, and John from Human Service Coalition to talk about our grant process. And there's a few things that have come up with me over the last few years of being on the legislature. And when I look back, I look at some of the progress that HSC has made in opening up the doors to more agencies being able to apply for their grants, and that's been amazing. What I see during that process is issues that are related to the legislature, county admin, in terms of the budget, and what that information then looks like for HSC when they're making decisions and what that looks like, and I'll explain. So during that grant process, agencies from the community, they apply for funds and decisions get made. And then at the same time, county admin is working on the county budget. And so John and team will say, okay, these 15 agencies are going to get funded at this amount. and then they're told, well, this agency, and that agency aren't going to get funded because this is outside of what we're going to approve your budget for. And that becomes problematic, in my opinion. And then we get to the budget process and the over-target requests, and then legislators are trying to put things back in. So my hope is to come up with a system that's a little cleaner for this year. Ideally, what we would do is come up with what the county's priorities are, maybe their top 5 funding priorities. What are we looking for? And then as John and team go through the applications, well, before they even go through applications, they can let folks know these are the priority areas that we're looking to address, and then people can apply for that. In the meantime, when county admin gets the budget mandates or the budget instructions from the legislators, county admin can say to HSC, this is what your money looks like for the year after we take out our 2% or 5% increase or whatever it's decrease. And then when they're approving grants, it's fitting into this dollar amount versus approving and then getting a different dollar amount afterwards. People follow me? Does that make sense? Am I making that clear? So that would resolve one issue. And then they would have Pot A, which is the monies, the applications that fit into the approved budget amount. And then there's Pot 2, which people could then look at OTRs, or if their budget adjustments, there ends up being a little more money, they can add those back in. And the goal is to do that for this budget cycle. John, did I miss anything or misrepresent what we talked about?
No, I think that you got most of it. The only other thing I would add, Travis, is that one of the things that we want to incorporate into the process this year is a more formal or intentional collaboration with the agencies. So as part of that, county administration will be setting up time for us to, and whichever of the legislators are going to be part of your working group, time for us to provide the county departments to provide some feedback on the priorities as well. And then when applications start coming in, we'll be working closely with the county to identify if there are places where there's overlap with other funded projects, or if there's a better place for a particular applicant to be pursuing funding rather than through that process. So I think you got everything else, just that working together more closely and more intentionally this year.
Thank you. That's Part A. Does any of the legislators have any questions about Part A? Because there's more to it. All right. So Part B is looking at the next piece of this. So, and this would be a goal for 2027 going into the 2028 budget season, because this is a longer piece and it'll take some time to sort this out. So this isn't something that would happen this year. During our budget process, we have county departments that get funding directly from the county, and then there's at least 1 or 2 agencies that get separate funding from HSC outside of the grant process. At some point in time, probably for very good reasons, these agencies were brought into county funding, and they started getting funding for their programs. And over the years, it's become an expectation that they are just going to get funded, and they're going to get funded at the regular funding rates, and that's what it is. For me, in my humble opinion, it's problematic for a few reasons. One, there's no real oversight over that money. Every department that you heard from today and across the county, they have to, they're held accountable down to a stamp. There's not funds that they get to spend that we don't know about. Jenny can't say, oh, that was an operational. Everything is accounted for, but we have agencies that don't have that same requirement. The other piece is some of these folks have been getting money and maybe doing great, amazing work, addressing a lot of needs in our community for years. And my question becomes, if we're looking at our departments to make changes like Whole Health has, why are we okay with community agencies doing programming the same way they did 20 years ago with 2025, 2026 problems. The other piece of this is an equity issue. There are other agencies that have come along since some of these were created, that were created to solve certain issues in our community, but they don't get the same funding or in the same opportunities for funding that these agencies get. So during the next year, the working group would come up with a new process, and the process would look something like this. The county would have their priorities. Just like we do, we would send out to HSC. Different agencies would have the opportunity to respond to an RFP or develop an RFQ to how they would address those issues. And those funds that go out to these different agencies would be opened up for agencies across the community. And hopefully, the idea that, just like John explained, they would be working with different county departments to meet needs that we weren't able to meet. And every agency would have an opportunity to either reply to an RFP or submit an RFQ, and we'll figure out what that looks like along the way so that all agencies have equal access to those fundings, the funds. And then hopefully during that period of time, over this next year, we'll work out the mechanism for what all of that looks like. That would be the plan for the working group. It also allows for agencies who have been getting that funding to know that come 2028, things will look different, and they can get prepared for it. So this is something that's going to extend out over a period of time. That's part B, and that's a much more work has to be done with that, so we do have some time. I said a lot. I went through some things pretty quickly. I'm sure there's questions, so if you have any questions, please, now is the time. Rachel.
So for some of these agencies that have been receiving funds long-term, the idea is that starting in 2020, they'd understand that kind of like it's a clean slate, and everyone is being looked at equally each year going on. So maybe people could apply for multi-year funding, or it would all be kind of 1 year at a time from then on.
So I'm glad you said it, because I did forget a piece, and this goes for both the grant process and this process. It could be multi-year funding. One of the things that we talked about in a meeting with HSC, and one of the concerns that I have is people apply for funding for a year. It's so difficult to plan programming, get things started, if every year you're applying and you don't know if you're going to get the funding, and you're trying to hire new people, bring new people, get things set up. So people actually don't know the results of their application and what's going to happen until we approve the budget. So now in November, sometime in November, you're trying to get something up and running by January, and that's really challenging. So the idea would be to kind of create two avenues for funding. One would be a 1 year cycle. The other one would be a multi-year cycle. Agencies would understand that just because they were approved for $40,000 a year over 3 years, that's not guaranteed until the budget is passed. But at least they would know that they have a 3-year opportunity for this program. They just kind of have to wait each year to see what happens with the budget, because there's no guarantee that it would get passed. But I think if you're a nonprofit and you're applying for funding, knowing that you have this money potentially for a 3-year program really changes things quite a bit. John, I'll lean on you again. Is there anything about that you would like to add?
No, I don't think so. I think that's even true in the past for the agencies through HSC's funding review process, where it has resulted in a multi-year funding over target request, for example, or enhancement. I think even in that case, they did understand that even if it was approved by the legislature for multiple years, that it still had to be approved again for any particular subsequent budget year. So I think that understanding would be clear to applicants, and we, at least through our process, we would continue to focus on that as well.
And so whether we used a multiple year funding or a sunset clause where this was good until this period of time, that would all be what the working group came back with and said, here's our recommendations for how to make this happen. And yes, if we said we're looking for a 3-year program to address customer delivery at such and such, or we're looking for to address
Nutrition security. Nutrition security.
Yes. Somebody would say, well, here's our application, here's our RFQ for a 3-year program, and then we would fund them for 3 years with the understanding that each year we had to approve the funding, but at least they would know in theory that this was a 3-year deal, if that makes sense. Is there any questions from anybody?
This sounds really interesting, and I think from my brief time, with the county, it seems like this is a real need to support both our partners, community partners, and to provide a pathway where departments can sort of better interface with some of this work. And so I'd really love to know how we could be included in some of this priority setting.
Oh, I'll tell you how.
Okay, because I could give you 3 right now.
So the goal is to establish a working group to do this, and it would be somebody from admin or somebody's from admin, be some legislators. Of course, it would be good folks from HSC, and I would love to have department heads be part of this. You all budget. I mean, this is like, I don't know, what 90% of your job is budgeting and dealing with emerging needs. You all have a better idea of what your limits are, right? And then what is helpful to have the community be involved in, right? So I definitely feel like as we, and hopefully in the next few minutes, we kind of get people to volunteer for this working group, want department heads and their feedback and their expertise to be part of this. I think the other piece of it is when we have a reduction in the budget for departments, it's very difficult to look at a reduction in the budget and then look at folks who are not county departments, and I go through this with the city, getting full funding, right? And it affects the staff, it affects programs, it affects morale. I've been fortunate enough to be at GIAC for almost 27 years next month, and for 27 years, I'm like, damn, we have a reduction in the budget, but look at these new agencies that are coming along and getting funding. That's great for them, but we do this work as well. And we have to constantly figure out how to go find funding, especially when there's a reduction. So I definitely feel that in order to make this plan as robust and as diverse as possible and successful, we have to have department heads at the table. And then you all may feel once you get together, there should be others at the table, and then we'll build it out from there. But we have to move pretty quickly. The idea is to, at the very least, in April, to give HSC the 5-6 priority areas for funding so they know. And then to work with county admin to say, okay, I'm making up a number. Last year you had $300,000 in this pot. We finally got the budget instructions from the legislators. This year we could commit to $275,000. That's your starting point. And then more may be added, but at least they know as they're approving these budgets and these applications that $275 is their target amount, not $300,000 and then it getting reduced later to $275 and having people on hold, and then we have to bring in OTRs, at least for pot number 1. So some of this work is kind of immediate, and then the rest of it will be over the course of the year, getting prepared for 2027, so folks know what's needed for 2028. Kate.
Yeah, one of the things that I would offer up is we have started a department head dialogue group, which is made up of 15 department heads from around the county. And so we talk about issues that are important to us, important to you guys, and also important to county administration. And we're currently setting our goals and figuring out how to come to the table and to be more proactive and to be more assistant to you guys. And so I'd love to talk to you about that later and how we might be able to support you.
Awesome. So are there legislators in this space now that are interested in being part of this working group? Oh, okay. We have Rachel and Veronica. Mike and Christy, I don't, did you put a hand up? Christy.
How many can you take?
We can take quite a few as a working group because what you all are doing is coming back with recommendations, right? There may be folks outside of this committee that might end up being interested. Is there a person that is interested in leading the group? Christy, you might want to put your hand down unless you are interested in leading. We need a group leader. Is there a person interested in, Christy, your hand's back up? All right. So
yeah, I don't mind coordinating.
We have a chairperson, so to speak, for the group. Was your hand up to also? Chairperson?
I was contemplating it. I was more going to ask, like, are you not leading this group?
No.
That's fair.
I'm not leading this group. I'll be part of this group, but I'm not going to lead the group. So we have Christy, we have Rachel, Veronica, myself. We'll open it up to other legislators while you good folks are here. Is there any department heads who are here now that are interested in being part? All right, we got Jenny. Man, I love this.
I don't know if I want to be at every meeting, but I'd like to be able to able to contribute somehow, so.
Awesome. And we got Kate. And I'll send out some, once we have the first meeting, I'll send out some stuff to other department heads and they can see. And it's definitely fair. Y'all's workload is crazy to begin with. It may not be a need for every meeting. There might be some stuff that can go back and forth. We certainly can do Zooms and not have people come in person. I know that definitely works for people's schedules. But we'll send out something for the first meeting and get this started. I know that it's a priority. John, you all could figure out from HSC's end who would be part of this. And Bridget, Corsa, I don't know if Norma is going to continue since she was part of the original conversation. But you all could let me know who's going to be part of that, and then we could get this going. Is there any other discussion items on goals? We will do some prioritizing between now and the next meeting, so we have this kind of in priorities, and then put which ones that we are looking for possible working groups or legislators to kind of head up. Veronica.
I guess a couple things. For the one, I'm excited about the HSC working group. I think having people from BCP on it is also important, which like Christy and I both are, so could be covered, but that could also be a place to invite people, because I think like you, Travis, ran through a lot of the difficulties with the funding here, and I think a lot of the pieces are lack of clear communication between the parties, some of which is like the oversight and reporting from the agencies, some of which is about like I think we the legislators we see more clearly the funding requests from HSC that come out as OTRs and not some of the ongoing stuff, which like maybe it's to some extent like you sort of stale, stagnant investment, and maybe it's like sort of critical, like people depend on it and it's effective investment, but we don't see it. I remember last year, I don't know I could say all this in the working group. Last year, like I think I put forward an OTR at the very end that Cindy suggested by pointing out, and somehow he'd missed this, that like one of the requests denied was part of a multi-year OTR, which like it was said, it has to get approved every year. But I think we didn't even know that this organization was kind of expecting a second and third year, or maybe it was just a third year, I forget. That's the kind of thing. So I guess a lot of this process also has to intersect with, does our own budget process need to adapt as well. And also, I think ideally, something that bothers me often about this is maybe I'm preaching to the choir here, but sometimes I think people feel like the funding to the HSC agencies is a gift or a prize to the organizations, when ideally it's an investment into an organization that is doing work to further the whole county toward our goals or our vision. And so getting to that point seems like a good North Star for the group. That was one comment. And then the other thing on goals in general was, did we skip the one about the DSS advisory board?
That was in one of them, and we did skip that. That is my bad. So I know that we are moving toward a direction. We have gone back and forth with county administration on what process would be best. I believe in our December meeting or November meeting last year, we chose to have the advisory board that would kind of report to the legislators. I guess what we could do is, when I send the information out from the goals to Dina and Brittany, they can report in March where we are with that process, so they can get together with Corsa, figure out where they are, and then share back with us in March. Does that work for you, Corsa and Dina?
Yes, it does.
Okay, cool. So we'll do that for March.
So I have to say, I have to confess I'm multitasking a little bit. So I'm not exactly sure what you're looking for March. I got the April stuff down.
I didn't catch that last part, Dina.
So what specifically are you looking for from us for March?
So for March, there would be the questions I'll send you that came up in the goals. And then I don't know if this is as much for you or if it is for Corsa, but to find out where we are in the DSS advisory board and what those next steps look like. We talked about it. We kind of picked one of the avenues. In all fairness, that was like the end of December. So I think if we do the report in March, that's about 3 months. I think that should be good. Corsa?
Yes. So I think I believe Brittany is on vacation as well, and we'll work on getting something to you guys. As Dina indicated, having a lot of competing items on the table that we have been working on. The other side of it is we're trying to understand the nature of the advisory board that the legislature wanted to set up. If it is as based on information that was provided by Katrina as well, members of the board is usually appointed by the chair of by the commissioner of social services, or and that advisory board provide advice to the commissioner. The other side is for information purposes. The legislature can have some form of a public advisory board in that nature. I think Katrina will be best suited if she's available to give you the context of it. But we will be able to work on getting some information, at least some degree of mid information for you guys next month, and then it help elevate the conversation. And then if we are clear in the direction that the legislatures would like to go in, then we can bring a resolution forward in creating such a body.
I do believe that in December, we picked the latter of the two options. We picked that there would be a group that would report to the legislators, an information group for the legislators, and not an advisory group that would report to DSS.
Yes, so in that frame, that will be members that I believe the legislature will need to appoint. But yes, we will, I'll get together with Brittany and everyone, and then we'll bring something before you in March, and then we can take it from there. So yes, I'll work on getting something to the agenda for March meeting.
All right, that sounds great. While I got you, we can move over to the Office of Human Rights discussion.
Okay, thank you. And sorry I'm not in camera. Due to a few issues, I'm not in town and I couldn't be present, so I apologize about that. So from 2025 January when I came on board, I was given the task to evaluate what options we will be dealing with in terms of the Office of Human Rights. For clarity, when I came in, the Director of Human Rights wasn't with the county anymore, so we just had the receptionist, who was then working in the county administrator's office. We have gone through several discussions, several engagements, and myself and the Commissioner of Human Rights did presentation regarding the rationale of keeping the status quo and also maintaining what we had. Further, after the budget process, I was instructed to bring before the committee some degree of variation of options because the office doesn't really provide investigation as was previously determined. So I brought an array of options, and one of the options that several committee members were in favor of seeing was an option that was require creation of education and outreach coordinator, and also elevating the reception position to administrative support. Following that conversation, I had several conversations with the Commissioner of Human Rights together with the county attorney, and we discussed which direction we need to go in and what will bring the value that the office needed. So following those conversation, the position of human rights, give me a second here. I'm just pulling the resolution, one second. So following those conversations, we made a determination that for us to maintain some degree of the core work of the office, position of human rights programs manager may be ideally suited in providing the needs that exist within the county. I also discussed that with the chair of the commissioner, and also get her input in terms of how they feel the functions or the office can give us the best outcome. Also, as part of the presentation that I did was eliminating the office space where the Human Rights Office is at the moment. Going back to the resolution, I know the resolution had not yet been introduced, and I'm speaking to it, but the resolution is asking for us for now to maintain the office because the reality is that we do not have a space anywhere else for the staff to operate from, and we need to maintain the lease space and come up with a goal. I have started working on those goals with the individual that will be hired in the position to work with them and provide a program plan for how the office will really be functioning over the course of the period. Additionally, I just wanted to indicate that this resolution does not automatically create the office. The office has to go through normal HR processes with GO before we can create a new position. So this resolution was just to bring in some degree of realignment with the office, bring some degree of effectiveness to the operations of the office, and enhance the relationship between the office, county administration, and also the office and the office and the Human Rights Commission, for us to really see value in some of the work and some of the expectation that exists within the community. And so that is the rationale behind this specific resolution. As you can see in the resolution, there's no budget numbers on it yet. Before we can be aware clearly of how much the payroll will be, we have to create a job description. I just email all of you a draft job description, right? It has to go through HR. They have to vet it and make determination of what salary grade that will be in, and they will be able to have a clear idea the degree of savings, if any, that we can realize within the current payroll structure of the Office of Human Rights, and how those funds can be repurposed into program promotion and development within the office.
Of course, just so I do this the right way, there's the discussion of how we got here and what your suggested solution is. And then there's a resolution on the table. So before we get into the resolution itself, because we got to move that and second it and then open it up for discussion, is there any questions from legislators to how we got where we are and what the solution that Corsa suggested is? Rachel.
So, and I might be misremembering some of this from watching meetings from last year, but so I thought part of the discussion was that if we don't hire, that we weren't going to hire a director, because part of the idea would be that we're going to hire someone who's then going to help evaluate the office and decide what kind of structure it should have. And so that if we hired a director, it'd be unlikely that they would then come around and say, I don't think you need a director.
Right.
But then, and maybe this is just a question about the resolution, but it does look like we're transitioning the position of Director of Human Rights to be this position instead. And so I didn't know if that meant that we were actually kind of officially changing the structure of the office before we went through the process of getting a recommendation from someone who's being hired to reopen this office. Does that make sense?
Yes. Sorry, Travis. So yes, we're not. So first and foremost, the position of the Director of Human Rights is a chartered position. The only way we can change that provision or formally change the structure of the office is to go to charter amendment to eliminate that position. So for now, the position has not been filled; it's vacant. Even though it's a chartered position, if you go into a transition and we have not filled the position, there's no mandate to fill that position. It's not a mandated position. So we can create this position and fill it and make determination how effective the office can function. One of the issues that I met or I was informed was previously the county has an ability through an MOU with the New York State Office of Human Rights to conduct some investigation. And I believe some years back we lost that resolution, that MOU ended and it wasn't renewed by New York State. So we didn't have a discretion of really conducting investigation. We're really referring individuals to the state to file complaints and issues of that nature. The other side of it is that the job description that we have required a minimum of somebody with a JD, so that put the salary scale way up there, and the job is more of education and informative, and also managing one staff in that office. So the conversation I had was, is there a way we can improve the office functionality at the same time be cost effective and realign the cost factors of it? Yes, the office is meant to be part of the center of government when we finally build it, but at this point, we're looking at how do we bring some degree of efficiency and effectiveness to the office, and secondly, how do we improve the relationship between the commission and the office, and also the reporting structure to the legislatures. From some of the few things that I was informed of or made aware of, there was some degree of gap between the commission and the office, and we're looking at how that gap can be closed. Because based on the charter, the Human Rights Commission is more of an advisory to the Office of Human Rights as well. So we're looking at how we improve that relation. So we are not really formalizing, eliminating the position of Director of Human Rights. We believe that the position of Human Rights Programs Manager can fulfill the clear objectives and goals in the charter in terms of what the office needs to do. And at the same time, I think what is really critical for me is the individual that we hire into the position and what they bring on board, and the ability to really do some real good work within the community, and that's what really is critical. So we're looking at how we can find such an individual who will be very collaborative and work well with people and be able to bring organizations together and improve outcomes within the office.
Okay, thank you. And will we also then bring the receptionist back on once we open the office and hire the manager?
The receptionist is still on, but the individual in the office has been out of the office for a couple of months now due to sickness. So that position is still active.
Okay.
But as we speak right now, there's zero active role because of lack of personnel in the office. County administration pick up some phone calls, and we try to direct people to either Law New York or other places that we believe they can get support based on the questions. My understanding from talking with the Commissioner of Human Rights is that they get a lot of undirected emails and inquiries and requests for support. But we have not had that synergy in maybe sharing that information yet. But I believe as this process move on, the Commission will also voice, maybe come in and contribute to the process and see how we can best enhance what we're trying to do collectively.
Okay.
I think what we should do, because we kind of are blurring the lines of talking about how we got here and the resolution itself. And so I think we should see if we move the resolution forward and then go from there so we can talk about the resolution. So resolution, establishment of Human Rights Program Manager position and reorganization of the Office of Human Rights, ID 13875. Do we have a mover? Rachel moves. Do we have a second? Veronica seconds. So now the resolution itself is on the floor. Is there any questions about the resolution? Rachel? Or go ahead, Veronica.
No, you go first. And of course, I apologize if you already explained this. So the process would be that if we pass this resolution, then a job description would be written, and then we would have the opportunity to look at it. I guess I'm curious how the job description would be different than the director position, and whether the person hired would end up feeling like they're potentially getting paid less than a director, but kind of expected to do the same or a similar level of work if there's not actually a director above them in the office.
So not necessarily the case. It's all about the individual, really. So the person, whoever we hire, is not filling the position of a director. Is coming into a new position that we have created with a new job description to provide specific role and expectation. The individual will be reporting directly to county administration. We will have goals that we will measure that individual with, and measure how we achieve those set goals. So it's not replacing the director, but creating a mid-level management position that will help reorganize and revamp the office from ground up. Let me add that.
I think to add to the conversation for those folks that are newer, when the last person was hired for OHR, we had already received the instructions from New York that we weren't allowed to investigate anymore. There was quite a bit of turmoil at the office, and we brought in somebody to stabilize things. We didn't necessarily hire somebody to operate OHR with specific goals in mind, because we didn't know what those were at the time, because we had just lost our ability to investigate. And so, Veronica, you please chime in. Over the last 4 years, the questions have come up. What does OHR do now that they can't investigate, right? They lost their investigative powers. What is the goal of the office? What are we asking them to do? And I don't know if we ever really established that. And this allows us to kind of establish what the goals are, what the purpose of OHR is, and then hire the right title and hire somebody to meet those goals that we established now, because they weren't very clear over the last few years. Some parts were a little ambiguous. But now I think we are developing what the path is forward, what type of title you need to achieve that, and then obviously hiring the best person for that goal, for that new position. So it's a little different. When we had investigative powers, it was much different. Veronica.
Yeah, okay, I feel like I should understand this by now, but it looks like this resolution is ending the department, like ending the Office of Human Rights as a separate department without explicitly saying so. Is that correct? Corsa?
Not necessarily, because when we had the Office of the Human Rights, the director of the office did report or was supervised by the county administrator then. So there's nothing new here. It's just more of a clarity of oversight. As much as I think there's that expectation that the office is somehow independent of the county administration, but the independence of that office lies in the core functions. But in terms of maybe budgetary decision making, other things, they rely on approval process within county administration, finance, and other places to execute their things. So they will. Yes, I do not have the skill set to run the office as a human rights director or propose direction on how the office will be run, but we're just trying to bring some degree of expectation and oversight and responsibility within how we operate or how we spend county funds. I do believe that in my mindset is that every single department or agency that we provide funding to will need to provide some degree of report for what those funds are being used for. And I'm just trying to make it clear within the language that whoever is filled that position when we eventually create it will be aware of the responsibility and accountability that will come with the role and the reporting needs of that office.
Thank you. I guess I'm looking at two things in the resolution. One is the resolved that says the position of Director of Human Rights shall be transitioned consistent with the county charter and applicable law, including initiation of any required charter amendment process. So transitioned is a little vague. Are we saying, is this resolution saying that the position of Director of Human Rights is to be gotten rid of? Or is that maybe or maybe not happening depending on what this future human rights programs manager decides in collaboration with the county administration and I guess the legislature is necessary?
I don't think that the goal is for the position to decide. I think it's up to us to evaluate how things look, how things feel, what's going on in collaboration with the commission, and then decide, do we want to continue this model, and then what are the next steps to do that? Or do we want to go back to having the OHR, the department head title, or do we want to do something different completely? But I don't know if it's for this person to kind of tell us what should happen. I think you're just automatically going to be some biased. I'm not going to give up my job, so I'm not going to tell you, get rid of my position and do this. So I think that should kind of be from us, from the commission, and definitely, without question, from county administration. Over a period of time, we can have an evaluation of what this looks like. We can share that back with this group and then kind of go from there. I don't know if that answered your question.
It does partially. So the future programs manager is not really going to be part of this decision, but the decision of whether to keep the position of Director of Human Rights, that decision, are we making it in this resolution because of this resolve that says the position shall be transitioned? Or are we pushing off that decision until later, kind of like Travis described?
Yes, so you're not making a decision to eliminate that position at this point. One of the things that I spoke to Maury about when I put this resolution together was also the time constraints around it. I'm comfortable if you feel that maybe this provides some kind of inherent direction that we don't want to take that direction now and want to eliminate that specific resolve, I'm very comfortable with that. But that's not the desire. I don't think changing the office or changing the position of the director is not a responsibility to the person that will be hired. We need to come up with a clear goals of what our expectations are of the office and measure that individual's performance based on those clear goals. And then we can make the determination based on future changes if we still want to maintain the structure or if we want to revert back to what we have. One thing that I'll say is that, yes, it's difficult you have to go to local law to make charter amendment, but you have the power in terms of changes you want to make organization-wide. So at any point in time, if you feel that the goals for the office are being achieved and we are all comfortable and we're excited about what they're doing and want to really codify amend the charter to reflect the current organizational structure, then we can absolutely do that. But this is not to start the amendment process. The amendment process will begin with the local law, and it completely will be separate from this.
Okay. Then can I move an amendment to this resolution that resolved, I'm looking at lines 38 and 39, that maybe instead it would say resolved further that sorry, I don't know how to word it. Like, after the Human Rights Programs Manager has, like, been in the role for a while, this is not good resolution language, that the position of Director of Human Rights, as well as the structure of the Office of Human Rights, shall be reevaluated and, if necessary, transitioned consistent with and keep the rest of it.
So what if we put, after a year of, like we put a time frame on it, a year after the position has been filled, we'll do what you just said.
That sounds good. So resolved further that after the Human Rights Programs Manager position has been full for a year, the position of Director of Human Rights and the structure of the Office of Human Rights shall be reevaluated and, if necessary, transitioned consistent with and keep the rest.
Is that friendly to the mover? Did you move?
Yep. Rachel.
Rachel moved?
Yes, I mean, I guess I had another question about whether this position was going to be a temporary position. Like, are we saying that we want a manager for 3 years or 5 years? Or, and then saying we're going to do that reevaluation and at the end of that period, but then because this amendment would signify a timeline. I was just curious how that ties into like hiring a permanent position.
I'm not sure. Corsa could better answer that, but I don't think we're advertising, if we get to that point, that we're looking for somebody for a year. We may get to a place after the evaluation where we, this person may be in that position for another year if we're hiring somebody, right? So, and I don't think there's a time frame to that. And we may find ourselves in a position where that's a position that becomes permanent and we hire somebody. So I'm not sure how to answer that. Corsa?
Yes, I think it's more of it's a very difficult question to answer now based on the fact that we don't know how the position will function within the organization. I think, like I said earlier, one of the key things that I'm hoping that we can strengthen is the relationship that exists and also how people are provided with support if they call on the Office of Human Rights. I do believe that if we are clear about the goals and those goals are achieved within those goals are achieved within the structure, then I'm sure it will satisfy why the office exists and what we need it for. So, like I suggested earlier, I think because sometimes the people are worried if they're applying for positions that are temporary and they're not sure if it's going to be maintained, and you may not get the best applying for such positions. So I'll be worried if we put a caveat on it that shows that maybe the position will go away at some point. Maybe the person we get will be very eligible for the director position in the future, but making it more vague at this point and because every single position gets evaluated periodically. As you all know, when we hire an individual, they are on higher rate for 9 months. They evaluate it and go to a full salary rate after that 9 month period. So there will be a continual evaluation of the office and the outcomes, and then making sure that we are achieving the expectation of the legislatures.
Okay, that makes sense. Thank you.
So is Veronica's amendment friendly to the mover?
Yes.
Okay, so it's friendly.
Thank you.
All right. Is there other questions about the resolution? Veronica?
Because I have one other question, sort of about the resolution, is while we're messing with titles, the other position in the office of receptionist, I have been told, though I've not independently verified, that that is the only position called receptionist left in the county, and that it might be past time to transition that title to something else.
Yeah.
We don't have to do that in this resolution.
That's the only position in the county.
Sorry.
So sorry.
Go ahead.
Yes, that's the only position in the county called receptionist. And I'm already in conversation with HR to look at transition that position to other administrative support. One thing that I would say, individual in the position has been there for a very, very, very long time. So we are looking at what other options exist within the county that can reflect what the individual does and how the role, how the role will be actively supporting the functions of the office. So there is a plan in place to eliminate the receptionist position and upgrade it to something else.
Okay, awesome. Thank you.
Other questions about this resolution? No? Well, let's take a vote. We'll start with Christy.
Yes.
Mike?
Yes.
Veronica?
Yes.
Rachel?
Yes.
And I'm a yes, that is unanimous. Thank you, Corsa. We look forward to next steps, and definitely look forward to hearing the updates about changing the receptionist title and what that looks like.
Thank you, Buddha.
Corsa, the chair's report, the county administrator's report, I know this was on your plate. Is there anything that you or Bridget want to add before we go to departments?
From my end, no. I'll let Bridget add anything if we have stuff on her table.
Yes, thank you. Just to provide an update regarding the emergency shelter development project. So we are making great progress in our development of that project. We have some finalized conceptual designs that we plan to share more publicly in early March, along with an in-person stakeholder engagement session planned. We have worked with our consultant to gather a significant amount of feedback from various partner agencies and folks with lived experience. So we're excited to share what we've come up with thus far in early March. And from there, we'll be able to submit a complete HHAP application in April. And hopefully with good news in the fall, we would be looking at a timeframe of spring of 2027 to hopefully start the construction process. So happy to take any questions about that.
Any questions for Bridget? All right. We have 4 departments left to give some reports, and we'll go to Veterans Affairs with JR.
Here we go. All right, here we go. Can you hear me?
Yes.
Thank you. Okay. Good afternoon, everybody. And welcome to the new legislators. I haven't met everyone yet, but congratulations to you stepping aboard. In the way of updates, I just want to mention first, there were a couple of things said earlier. Jenny talked about the care team, and I just want to add my own voice to the work of the care team. Members of the team reached out to me, I believe it was last month, about a veteran that they were trying to help out, and just the level of questions and involvement that they demonstrated in that probably about a 15-minute conversation that we had showed me that we do have a good resource that does take into account the needs of the person that they're working with. So I definitely appreciated hearing from them. Also, in regards to Diane and Healthy Neighborhoods, I do hope this gets kept somehow or another. She actually came and represented the program at our Veterans Expo. It was our first Veterans Expo in November. And the information that she provided and the resources that she availed for our veterans and their families coming through, there were people who were exposed to what that position does and what that program does that would not have normally heard about it. So it's definitely something worthwhile, and I hope that we're able to keep it, however that means. Just in the way of my department, actually, this is a new season for us. So on two of the things that we have monthly, on the second and fourth Tuesdays, we have our Warrior Writers, which meets and basically Warrior Writers, not a D, but a T. So we come together and we write about different things that are happening, either in reaction to something published by another veteran, or maybe something in the news. And our facilitators usually ask us to write about what our reaction to, or what in a time in our life and service or whichever. And then we come back and we share what we've written and have it critiqued. And again, that's twice a month. And for the fourth Fridays, we have our Tompkins County Women Veterans Group meeting. So we had one last month, and they had a good time with that one. And we'll be meeting again on the fourth Friday of this month. Last month on the 16th, we were invited, and my office was able to help support getting word out for Cornell University's military appreciation duel. It was a wrestling duel versus West Point. And they actually recognized my department's work in helping them with the day. And then something we have on our radar at the end of this month is our tubing day with our college veterans. And this is going to be at Greek Peak on Saturday, the 27th. And I want to give kudos to my veteran service officer, Ignacio Lopez, with helping getting that organized. And then lastly, I look forward to meeting at least half or more of you all in March when you come visit my department for our orientation.
Awesome. Thank you. Is there any
That's
questions?
all on my part.
Oh, I'm sorry.
No, that's all on my part. Thank you.
Is there any questions for JR? Rachel?
Hi, JR. We've been emailing, but I haven't met you in person yet. Could you say the details of the February 27th event again? Is that something that's open to other folks in the community that we should share, or I guess you could share more details about that.
Yeah, this is actually targeted to our college veterans or college-age veterans, mainly because this is one of the groups that we like to try and target to, because that age range is considered part of that, the gap. I'm sorry, I'm blanking on the term for it, but it's basically a drop-off gap where we lose a lot of veterans to suicide. And so we try to do things that target specific groups, and this is one to offer them something to just get out, socialize, get with other people. And so other people can accompany them, but we're covering the price for the veterans themselves right now.
Okay, sounds good. Thank you.
Thank you. There are some events that are open, that we do open to the general public, and those are things that we do put out and let people know. Thank you for that question.
Any other questions for JR? Thank you, Mr. Claiborne. We'll go over to COC with Liddy.
Yep.
Hi.
Hi.
No, you have covered quite a lot of ground today. So this is my first time reporting at this particular committee, and I don't have a full report for you. I just want to introduce myself and make an offer to be a resource to anybody who's interested in learning more about the continuum of care. Continuum of Care is a large cross-sector group of people working to make homelessness rare, brief, and one time in Tompkins County. We look at data, we make plans, we do lots of stuff, but I know today's been a busy day, so I was in the HEDC committee updating thing, and I'll get used to having a report for you all, but for today, I just want to say hello.
Awesome. Thank you, Liddy. Welcome to HHS.
Happy to be here.
We'll slide over to DSS and Dina.
Just update you on shelter stuff. That was kind of one of our main things we do. So the Code Blue shelter peaked out at about 70 people during the big snowstorm we had a couple of weeks ago. And they've been averaging more like about 50 to 55 people per night since then. At Roadway, we currently have 34 individuals and 7 families. And then we have 24 individuals and THA individuals and 8 in Code Blue and hotels. And as I mentioned earlier, we've been working with Human Service Coalition and other community partners on getting information out to the community about how to address the ABOD work requirements that'll be starting here in the next month or so. So those are big items for us.
Awesome. I got to ask a question, Dina. Last year around this time, you all were still trying to figure out the shower situation at the temporary shelter. How different is your world now working with VOA and not having to figure out all these things that you guys were being tasked with last year?
Yeah, it's night and day. It's just having VOA taking care of everything, showers, that there's support services during the day. Myself and Adele and other folks who worked on Code Blue last year, we don't even know how we did it, to be honest with you, given all the other responsibilities we have. So it's like today, got a call, they need some help with something, I can email somebody and, they're taking care of transportations, it's all coordinated. We have some struggles with some difficult clients, but we're all able to come together and problem solve and come up with ideas. They've been really good on working with pets. We haven't had that many people come in, and so they've been able to accommodate most of them. So it's just gone really smoothly.
Thank you. I know I'll never understand, most of us will never understand what a heavy lift that was last year. And so thank you for doing it. Veronica.
So on that note, this might be more a question for VOA, but Dina, I have heard a rumor that the women's section of the Code Blue shelter is full. To what extent is that true?
I don't know. I've not heard that specifically. So it would be, I can, we have a meeting tomorrow morning. On Tuesdays and Thursday mornings, we always meet with them in county admin. So I can just check in and ask if that's the case and how they're managing things.
Awesome. Thank you.
Any other questions for Dina? Thank you, Dina. And last but certainly not least is HSC.
Well, good afternoon. I'll just keep you for one more minute. I'm stepping in for Cindy today because she is out of the office with her son who's on break. In addition to what we talked about earlier, had a nice meeting with many of the new legislators last week, and appreciate you coming by to HSC and meeting with us, and just want to make sure all the whether you're new or a returning legislator, always feel free to reach out to HSC if you'd like to talk about the human services system, not-for-profit organizations, and how they connect with county government services, or if there's any information or data or details we can give to you. My second update is just a heads up that some of our team will be presenting as part of the presentation tomorrow at the Facilities and Infrastructure Committee around Tompkins County's mobility vision. Folks from our 211 program who have the contract for the One Call, One Click Transportation Center will be presenting alongside folks from Go Ithaca and from Planning and Sustainability and other partners around where this county is moving in terms of transportation related services for folks. So we've got our hands in lots of things and are looking forward to working with you over the course of the year. Thanks.
Thank you, John. Any questions for John? All right, we are almost done. Department heads, community folks, legislators, my goal is to stick to that 1 to 3 time frame as much as possible. We may go over a few minutes. I would love over the next 10 months to give you back a gift of time every time we meet and get out of here early. We had a full agenda this week, but I really don't want to interrupt the middle of your week for a 3-hour meeting. Your time is extremely valuable. The shares really are just updates. There'll be opportunities for department heads to share their goals and what they do with us. We'll break that up over a month or two. Some departments have annual meetings and open houses, and that's a great opportunity to go and see what they do outside of, meeting with folks as you're coming on board and hearing what their goals and responsibilities are. So we'll always try to move things along as quickly as possible. If I'm moving too fast, please ask me to slow down. I don't mean to skip or rush through anything, but I really respect y'all's time. And I know that sitting at a meeting and you're only giving 5 minutes worth of information and sitting there for 3 hours can be burdensome. I get it. So I don't want to be, I don't want that committee to feel like that. So thank you for your participation today. Is there anything else from any other members of the committee? All right, well, we are met. Thank you.